Um, my journey really is what I want to talk about today. Um, I'm a nurse practitioner and I work in a rural general practice or primary healthcare clinic in central Otago, which is in the middle of the South Island of New Zealand. I haven't always lived rurally. I grew up in Dunedin, which was an urban centre, and did my nursing training in Dunedin and spent 3 years overseas as well, travelling and nursing. And when I came back to New Zealand, getting married was never really on the cards. It was never an option for me at that stage. However, I met a farmer and then my life completely changed. So I found myself living on a farm, um, down the bottom of the South Island of New Zealand. And really, at this stage, I had been working in neonatal intensive care. So you don't find a lot of neonatal intensive care units in the small district where I live. So I had to really rethink about what I was going to do for my career. Wanting to carry on with my nursing despite also having two small children early in our marriage. I never set out to be a nurse practitioner. When I started working rurally, I joined a practice where we had, there were two other nurses who were on the training program to be nurse practitioner. And I thought in the first instance it would be a good idea for me to sharpen up my assessment skills. So off I went to uni and did a paper. And then before I knew it, I had a diploma, a postgraduate diploma of clinical nursing, and then thought to myself, oh, well, I may as well carry on and do my master's because I'm halfway there. So I decided to carry on, and then suddenly I had a master's of nursing and had watched two other nurses in my practice become nurse practitioners and kind of thought, oh, now that could be quite cool. So off I went and finished my journey on the nurse practitioner program. Found myself working in a rural clinic. The clinic that I was working in was in a hospital that had an X-ray department. It had a blood taking lab. It had physiotherapy. It had the occupational therapist. It had a ward. It had maternity. So it wasn't really the rural that I was used to working at. So I carried on finishing my training there and did my first 3 years as a nurse practitioner. During that time, I really found it difficult getting to grips with the expectation from myself around what being a nurse practitioner meant, and also the people around me, because suddenly I'd been in the same job working as a rural nurse specialist and then become a nurse practitioner, and the nurses I worked with struggled with the concept of nurse practitioner because it was very new. So I spent 3 years in that job with the intention really of trying to consolidate my 6 years of study and the increased knowledge that I had around conditions that I was now expected to manage because I had the words nurse practitioner after my name. So I guess I felt a lot of things at that time. I felt a lot of imposter getting into my head. I felt difficulty with acceptance from other staff, both medical and nursing actually, because there was a lot of misunderstanding about the role and how it would fit into the current model that was already present. So what I tried to do to get through these challenges was to be really patient with myself. I really needed to think about, some of the things I'd learned over my course were some 6 or 7 years old, and suddenly I had to try and pull everything back into the care that I delivered to patients along the way. So I was really patient with myself, and I also had to educate others about what my role involved, what it is and what it isn't, just so that people really had an understanding. I offloaded a whole lot of other commitments that I had that were cluttering my head, because I felt that I needed to focus solely on consolidating what I was doing as a rural nurse practitioner. And also I wanted to gain some more understanding about what it was inside my head that was saying to me, you should know that, why don't you know that? You don't need to go and look it up because you should know it. And then I noticed that the doctors around me were also looking things up, and I started to realise that I actually had imposter syndrome, and so I needed to think about how I was going to manage that. So that was where in my career I started to have professional supervision for the first time, and it was really quite powerful, and we worked through the process of what I'd experienced leading up until that point and what I wanted for the future. So I gained a bit more understanding about that, and I started to trust myself a little bit more in what I was doing in my day-to-day practice, and started to feel a bit more confident about where I was going. So it changed what I did in my practice. I no longer wrote a novel in my notes. I no longer wrote really defensively about, what I had to write everything down, because as nurses, we're trained, if you haven't written it down, you haven't done it. So I had to become really savvy, because we only had 15-minute appointments, and there was no way that I could do that lovely assessment and document the head to toe assessment like we were taught in our training. So I really had to change what I was doing. Professional supervision really assisted me in this, and it helped me change my attitude and my practice. So after 3 years, I left this job, and I went back to my rural roots, and I found myself a job in a very small practice that was very rural, where I am now, where the staff had a great understanding of what a nurse practitioner did. The trust that owned the practice were very supportive and saw having me as a bonus, because it had really struggled to find a general practitioner and to stay in that area and work. So suddenly I found myself as a gap filler for a GP, and the patients were starting to call me Dr. Kate. So again, I had to revisit this whole imposter syndrome again, and really reground myself into what it was I was able to offer, what I was able to achieve in my day, and building those relationships with my patients around my role as a nurse practitioner and not a GP. So that was also quite challenging. So along all of this, probably what I've really learned is, be yourself and be true to yourself. Really get a feel for where you're at personally and professionally. And it's important to integrate the two, because, you spend maybe 10 hours at work a day, but you also need to go home and fit into where your family sits as well. And so I found that initially challenging, because the role I'm doing now is not in the town where I work. I drive an hour on a Sunday night to a place in central Otago, which is rural, and I stay there 3 nights a week, and I work my 3 days, and then I go home to the farm. So that for me, again, has been another challenge in trying to disconnect myself from my work brain and reconnecting myself at home. So the balance of personal and professional life I've really had to work hard at that, to make sure that I can sustain my role. I've learned resilience skills, and probably I don't personalise comments from people as much as I used to around nurse practitioners, because I feel more comfortable and more confident in my role now that I'm 5.5 years down the track. I've got a much better understanding of myself, and I believe that my performance at work has improved as well. I think I feel really comfortable about the fact that, I don't know everything, and I don't need to know everything. I need to know where to find things, and that's enough. The staff around me are fantastic, and probably I don't have as much fear as I used to have of needing to perform. I try my best, and I do the best job that I can, but I also care about what's happening around me.